Morning, good afternoon, good evening. This is Dr. Gorias, your professor for MED120 Medical Terminology. It is now week 7, and this is a brief overview of the things to be done for week 7 and some highlights of the musculoskeletal system. Now, this is one of your more useful, well, um, all of your medical terminology is useful, but this has direct applications to your anatomy and physiology, especially the muscular, naming the muscles and naming the parts of the skeletal system. So it's this is chock full of a lot of useful medical terminology that you will be using in the near future or currently using. And again, I have to state that I can't see everybody's everything. So please, even if I don't email you, if you don't see a grade, it means I don't see it. Or if you see a 0, I don't see it. Remember, critical listening exercises 1, 2, and 3, response exercises 1 and 2. Now, this practice stuff, it's kind of semi-optional, but this is the things that I need to see when I do the grades. But again, like I told you, there's like a glitch in the medical language lab. Sometimes I could see it, sometimes I don't. So take a screenshot of it and shoot an email to me so that I can acknowledge it and then put the grade in. Okay, so you can get your credit. Of course, keep on doing the quizzes and discussion forum this week, and I guess will be, of course, case. So, new discussion topic would be discussion 7. And again, as always, kindly design a 10-item multiple choice question based on one or both of the cases in the musculoskeletal system chapter. Again, due date for this is next week, of course, as usual. But if you're having issues with your internet or just life in general, please give me a call. I'm very, very lax on extensions and things because of the current the current situation we're in. And I also posted how to register. Now, if you don't know what class is, and especially if you're health science and you're a nurse candidate, please give me a call because I also have a list of all the classes that you need as prerequisites, and also I can give you some quick advice. Also, look at your emails. Dr. Tampa at the Woodbridge campus, he's hosting daily, almost like Monday, Wednesday, Friday, of Zoom sessions. So check your emails. There's one today, I believe, that starts like at 1:30. Starts in about 20 minutes or so from the time of this recording. But there's multiple. But the best thing to do is just contact your advisor if you can't make any of these sessions, because that's what happens in these sessions anyway. You talk to an advisor, and I ask you the same questions that I ask everybody. What is your availability, day or night? Do you have any issues with online? And if you do, I have some suggestions for you because, again, we're in this never-ending online modality, and I am unsure if the university made the announcement yet, but they made an announcement to the teachers that looks like term 3 is going to look a lot like this current term, that the online modality will continue. And this is based on the government of the Commonwealth of Virginia to extend the quarantine protocols. That being said, things could change for a multitude of reasons, but in general, most likely, term 3 or the majority of term 3 will most likely be on the same online modality. All right, so if you're used to it, yay for you. If you're not used to it, all of us, and myself included, have to start getting used to it. Now, let's see. So, again, business as usual. Let's now look at And if I have another video or if I have some notes from a previous class, I will definitely, as always, share with it. Always look into your announcements. There's always good tidbits in there for your learning. And remember, this is keep all this stuff. It's a lot of it I've created myself. You know, to make this course palatable. So we go here in our table of contents. Let's cross our fingers because this particular laptop has had some issues. As you can see here, look at that. I usually get full bars, but whatever's going on with my wireless. Okay, so let us go to musculoskeletal, chapter 10 in your textbook. Wow, everything's crazy slow. So you can fast forward through this part. Alrighty, and again, like with anything, right? If you want to read the book cover to cover, do so. But that's a great way to fall asleep. So of course you look at the objectives, and the objectives always are they always first talk about the specialties, the modalities, orthopedics, rheumatology, and chiropractic medicine. Now, do know and understand that an orthopedist and a rheumatologist, those are MDs. They go to school, graduate school for MDs, so they can do surgeries and basic, especially orthopedics, is a surgical service. Rheumatology is a subspecialty of the Department of Internal Medicine. Now, what are their specialties? Ortho, straight, peds, walk. Those of us who've had any musculoskeletal disorder or a broken bone, even if you break your finger, you're not walking too well. Every little thing hurts, and that's the Department of Orthopedics, and they usually solve their problems via surgery. But they have physical therapy and other items, but they usually deal with trauma and or bone disease. Now, a rheumatologist deals with the joint diseases. Rheumat means fluid, and the study of the fluids in your synovial joints, in your movable joints of your body. Now, chiropractic medicine also has a place in the world, and they're not medical doctors, so they can't interpret X-rays and CT scans, but they can order an X-ray, and also they can't prescribe medications, nor can they perform surgery. But what they do is they use like what's the word I'm looking for? Maybe it's in here. They do these manipulations, these stretchings and these other things to straighten out your skeletal system and your joints. And actually, there's a lot of really neat things that chiropractic medicine does. Now, let's look further. Okay. Excuse my internet. Yes. Now, if you look at, a lot of this is not English. You won't be responsible for the identification here, but eventually, if you're in anatomy and physiology, you eventually will be. And you can see how there are certain muscles named after shapes. So like deltoid, your delta is a triangle, so you got to use your imagination here, like this: 1, 2, 3. Excuse me. Or it's after this shape, like an orb or a circle. So you have your orbicularis oculi. You also have your orbicularis oris. There are also muscles named after things that they can do, like your masseter is part of your muscles of mastication. Mastication is a medical term for chewing. Your brachium means your arm, your upper arm. So if you had your triceps brachii, that means there should be three sets of muscles. There's one here, another here, and there's like another lateral one. Forms a horseshoe configuration. And there's how many? Three. And you have your biceps here, right? And if you see like, um, uh, you know, uh, bodybuilders and stuff, you'll see that there's two of them here. Pectoralis major, something that's major will be a bigger muscle. You have your pec minor, which is underneath it, which is a much smaller muscle. Um, your trapezius or your traps, right? You see it's in the shape of a trapezoid here. You know, a trapezoid is like a rectangle that has that that got squished down. That's the best way. Just so your trapezius has a shape like that. And if you use your imagination just a little bit, see how it's like this. Okay. You have your rhomboid, which is somewhere in here as well. That is also, and you know the suffix oid means resembling. So trapezius, deltoid, rhomboid, right? It looks like oid or resembles. Your gluteus maximus, of course, the large muscle. You have your minimus and medius. You have your biceps femoris. That's two muscles here, and it's in your femur, or the largest bone in your body, which is your thigh. You have your rectus abdominis, of course, in your abdominal area. This is your 6 or your 8 pack, and rectus means straight. Okay, so you have your rectus femoris, so it's not pictured here. I think it's one of these here. And that's your straight muscle that's in your femur. Tendons are things that connect muscles to bone. So here your heel, also known as your calcaneus, and it's connects your Achilles tendon. So connecting muscle to bone is a tendon, and connecting bone to bone is a ligament. Now, all of that stuff is fascia, or it's connected, right? So it's fibrous tissue or like supporting like bands of that aren't muscle, and they're used as coverings. If you've ever eaten a piece of chicken, you can see all the tendons and all this. You know this what I used to call second skin when I was a kid eating chicken. Fibroma, oma, tumor. Now remember, tumor is not a outright disease. It just means lump or bump until we have the biopsy that tells us different, right? Now, you have smooth muscle and you have striated muscle. Smooth muscle, if you look at it, it's visceral muscle, your viscera or your guts. That means you have no control of it. You know, like when your stomach grumbles and makes a funny noise, you have absolutely no control over that. But your skeletal muscle, also known as your striated muscle, that's the ones you control your fingers, your arms, your head, your eyes. That you have control. But smooth muscle, you don't. And leiomyo is smooth muscle. Loin, loin is your lower back or your lumbar area. You know, like where do you tie a loincloth around your lower back? Muscular, myo. Now, myorexis is rupture. If you recall that week 2 that was in the notes, rexis is rupture. Tendon, tenotomy, I cut into a tendon, right? I didn't remove it. And after I cut into it, what do I will most likely perform? Tendoplasty, which will be surgical repair. And it could be a surgical repair for tendonitis or tear or tenorexis, which is a little bit of a rupture. Which, you know, now with all the NFL draft that just passed, this is what a lot of people are looking into. Algia, pain. Now, let's look at this. You might have heard of myasthenia gravis. So myasthenia gravis is asthenia means weakness. So if you had myasthenia, you have weakness in the muscle. Myopathy, pathy, process of disease, myomuscle, hemiplasia, paralysis. Lysis, para, we already went over this term when we talked about the nervous system. Sarcoma is definitely, remember I said oma is just a lump or a bump? Well, sarcoma isn't a lump or a bump. It is a malignant connective tissue tumor. You have a sarcoma, you are in a lot of trouble. Myosarcoma, not very good. And a not so common tumor, but it's kind of famous because that is a name, Ewing's sarcoma, which is for bone. And if you have a sarcoma, it's definitely malignant. It's definitely bad news. Chondroitis, inflammation and infection of your cartilage. And as I stated previously, you can use your textbook as like, a quiz session as well. But it doesn't save, last time I recall. But it's a nice practice. Muscles, there's three types of muscles. You have your skeletal muscle, your cardiac muscle, and your smooth muscle. Right? And cardiac muscle, of course, act pertaining to your heart. Smooth muscle, also known as visceral, myo. And skeletal muscle is rhabdo, rhabdo. And maybe you've heard of rhabdomyolysis. People who work out too hard, like people work out like 2, 3, 4, 5 hours. I mean, like even Olympic athletes take breaks. They work out for 6 hours, but it's not all 6 hours is intensive. But there are some people out there just they really go a little bit too much, and you could get rhabdomyolysis. Rhabdomyolysis, adding an extra syllable there. Here's also a very good thing to know. Know your types of motion. These are a lot of these things we use clinically to try to evaluate the range of motion. And see, there's an angle here that is formed. So if you're flexing, you're changing the angle from this to this. So if the angle here is 180 degrees, then up like this is 90, and less than that is 90, is less than 90, right? So when you flex, the joint is getting smaller. And of course, the extension, when you extend out, the joint space is getting what? Longer or wider. So that's actually what orthopedics and chiropractors and rheumatologists use. They use this like little protractor thing called a goniometer, right, which measures range of motion. You have abduction, which is bringing your legs or your arms to midline. So you're adducting. Now, what happens when you're abducting or when you get abducted? Ab means away from midline. I don't know why they named it this way, so it'll be confusing, but this is how I remember it. When I abduct somebody, what am I doing? I'm taking them away. Taking away from what? Midline. Circumduction is easy. Rotation's easy. Pronation and supination. This is how I remember it. P, pronation, palm down, right? And it's like playing patty cake, and we use that in neurology to not only assess motor function, but also to assess parts of the brain. Eversion, those of you ladies who love your 4-inch plus heels, this might have happened to you at the club, right? You might have everted your ankle or inverted your ankle to cause maybe a sprain or strain. Now, sprain or strains, it'll have the same issues. You'll have swelling, decreased range of motion, pain, signs and symptoms of inflammation due to trauma. But technically, in the Department of Orthopedics, a strain is the overstretching of a tendon, and a sprain is the overstretching of a ligament. So that's a nice little orthopedics tidbit. Dorsiflexion and plantar flexion, really important when we do the Babinski maneuver. And if you don't know what that is, you'll look it up and you'll definitely learn what it is. But this is how I remember it. Plantar flexion means I'm planting my foot towards the ground. That's how I remember it. And the other one is simply the other one. So when you have two opposites, you memorize one like the back of your hand, and the other one is simply the other one. It decreases your stress level, especially during test. Oh, do more practice. Now, with the skeletal, it's a little bit more difficult to learn the names. But again, you start now, you get to it, and then the all the stuff in brown, that's your axial skeletal, and all the stuff in like gray blue is your appendicular skeletal system. So you could see that your shoulder girdle and your hip girdle is part and parcel of moving your arms and legs. And anyone who's ever fractured their scapula or their clavicle or their hip can tell you how well they were walking for a couple months or moving their arms. Here's some skeletal terms of note. Carpal, that's your wrist, like carpal tunnel syndrome. Carpal you got carpal tunnel syndrome, you will have a drop wrist or ptosis, prolapse or downward displacement. Now, ptosis, when used alone regarding your eyes, that's when you like really sleepy or maybe the effects of some medications, your eyelids will drop and you look like how people look like they're all high and stuff. Why am I can show you. See, they look like that. Now it could be a neurologic, right? Like this guy, you could see one is different than the other. You see, this kid has a right-sided facial ptosis, so you could see that the upper eyelid is like starting to drop. I had a nephew who had functional blindness in his left eye because of ptosis. And then, he took some meds and they fixed it. And he's like semi-okay now, but it's super obvious when you take a good look at him that his left eye is drooping, and that's called ptosis. Cervical, al, pertaining to your cervix or neck. And remember, you could talk about your neck, and also you could talk about the cervix uteri, which is the cervix of your uterus. Costal means ribs, so subcostal means underneath your ribs. Cranium, skull. So craniotomy, what am I doing in my skull? I'm cutting into it. And we usually use that when there's increased intracranial pressure or the pressure within the cranium. Because if you have bleeding, if your blood vessels in your brain starts bleeding, you'll start putting pressure. And enough pressure could shut things down, especially your respiratory system or your cardiac system. What else? Ribs, cervix. Humerus, or your funny bone, right? That's your upper arm. And you learned another term for upper arm is your brachium. Metacarpals. Meta means change. So it's not really your wrist. It's your wrist changing into your fingers. And your fingers and toes are called phalanges. So if I look at metacarpals, I look at the hand. These are my wrist bones. Right? Here's a better. These are my wrists. And then meta, change. These are metacarpals of the palm. And of course, your phalanges. And you have your proximal phalange, which is the one closer, to your, to your wrist or to your midline. And then you have your distal, right here. So phalanges could be either mean fingers or toes. Now, how do you distinguish? In orthopedics, you either say upper or lower extremity. So upper extremity would be fingers, lower extremity would be toes. And I forgot to show you again. Let's go back to metacarpals. Here's a little also side note. Yeah, you see here, first, second, third, that's how we number things. We number digits or phalanges, 1, 2, 3, 4, 5. So your thumb would be 1, your pointing finger 2, middle finger 3, ring finger 4, and your pinky 5. And it goes the same way for your feet. So if I fractured like my pinky on the end, I fractured, and this is the patient's right hand, my right fifth distal phalange upper extremity. And that's how we report it. And also, if you look at charts, now they're like, there's pictures. So there's pictures and charts, so we also label it that way. Spondylitis is your backbone, so inflammation and infection of your vertebrae. That's not good, because what's the vertebrae covering? It's covering your spinal cord. So inflammation or infection that close to your spinal cord is kind of dangerous. Your sternum or your breastbone, right? Sternocostal means the sternum and the ribs together. Heel is your calcaneus. So if you have calcaneodynia, I got heel bone pain or injury. Be careful with that because it's such a strong bone. I've had several patients who had hairline fractures and they were walking around for months. Didn't even know until it got really bad. Femoral, which is your thigh bone, your longest and heaviest and most and strongest bone in your body. You break that, you really, like, you know, in the movies, you see people kick that bone and like bust open. That's the movies. My patients who've fractured their femoral bone, they got hit by things like, you know, like a UPS truck or a bus. That's how strong your bones in your body is. That's the kind of trauma that level of force that's required to break a bone. Tib fib, your tibia and your fibula. Tib fib. That's slang. And those are the bottom bones of your calf, and your tibia, that's the big one in the front, that's where your shins are, and your fibula is the small one in the back. And they're kind of together. So you break this big one in the front, what are the odds of you breaking the one in the back? They're pretty darn good. And that's why they call it a tib-fib fracture. Pelvis for pelvimetry. We use ultrasound for that, or you could, in obstetrics, you could use your hand upon digital measurement of the cervix and the vaginal orifice when you're performing an internal examination or an IE. Your patella is your kneecap. Sometimes we have to do a patelectomy. We have to remove it, and then we replace it with artificial one. Now, the Department of Radiology, Logi, study of what? Radiation. So they do X-rays. So X-rays, slang for an X-ray is a plate, or another term for an X-ray is a radiograph. Another form of X-ray is a CT scan, where computerized tomography, where the computer takes multiple pictures via X-ray and then it puts it together. The computer puts it together. Ankylosis, that's when something's stiff or bent or crooked, doesn't mean ankle. So it's an immobility of a joint. Joint, of course, the space in arthro, the space in between two bones. So there's a whole bunch of arthritides or types of arthritis, and the Department of Rheumatology, they're experts at that. Chondro is cartilage, and if you'll notice your ribs, they have to have cartilage because now it's making me hungry. Human. If you look at this, see this blue? That's not bone. That's all cartilage. The only difference between cartilage and bone is the amount of mineral deposition, like calcium and phosphate. So the bones back here, they have to be tough and they'll protect you. Your sternum here has to be tough and protect you. But if you look here, there's all cartilage because you need to be able to breathe. So those of us who've had respiratory tract infections and had chondritis, right, or costochondritis, you know when your chest hurts every time you breathe? It's not fun. Ortho means to straight, so the Department of Orthopedics will try to straighten things out, right? prevention and correction of musculoskeletal system disorders. Osteo means bone, so osteitis, inflammation or infection of the bone. And if you're in anatomy and physiology, you'll find out that the bone is a living, breathing thing, and it's hollow and has things in it. So if you have things in it, and bone not only protects you, it does a whole bunch of other things. Osteoclast is a type of cell that breaks down bone, and also it is also a procedure that we use to actually break bone. Um, um, Sometimes when someone's bones didn't heal right, like my father-in-law fell out of a tree when he was younger, and he was a cop, so he didn't want to tell nobody. So years passed by, and he had this really awful hip displacement, and then they had to go and break his hip again to fix everything. Osteocyte is a mature cell. There's also an osteoblast, which is an immature cell. So anything blast is an immature cell or a growing cell. Arthrodesis, sometimes we have to immobilize a joint or fixate or bind the joint. We can use it via casting or pins. If any of you ever had the displeasure of having that done, I've had several in my life, not fun. Osteomalacia is a situation where your bones start softening. Okay, vitamin D, you'll learn, deals with your calcium metabolism. And if you remember, the only difference between your hard, tough bone and your cartilage is the mineral deposition. And your calcium starts, for whatever reason, you have a vitamin D deficiency, and then you start losing calcium, your bones will start becoming soft and brittle. Now, osteoporosis, it kind of is the same thing, especially in women who get older, past childbearing age, because women's bones are geared, especially during childbearing years, they're geared to release calcium so that they have milk for baby. Problem is that that little bit of chemistry doesn't reverse itself after after baby's been delivered and after baby grows up. So many women, you have to be cognizant about having regular exercise and watching your calcium and just taking care of risk for fall and that kind of thing. Osteoporosis, I already mentioned. Decrease in bone density, right? Because your bones tend to and affects females more than males. All right, diaphysis. Physis means growth, dia means complete or thorough, and that's the part of the bone. Let's look at the parts of the long bone. If you look at the part of the long bone, dia, complete or thorough. Look at the dia, complete or thorough, and as you can see, the bone is porous and there's things in it. So you have a epiphysis. Epi means on top of. So you have your distal and your proximal. Your proximal one will be the one most closer to your midline, and your distal will be the thing that's most like further away. And the diaphysis, dia, complete or thorough, is what? The main shaft. Okay? So if I have a diaphyseal fracture, it's where? It's somewhere here. If I have an epiphyseal fracture or damage, it will be on the ends. Okay? And you can see here there's a femur with a ball and socket joint, and the proximal epiphysis, that's the one closest to your hip or closest to midline. Okay? And you could go through all of those as well. And these are like little mini quizzes as well. Oh, here. You could also see that there's a covering, a periosteum. Peri means surrounding. You have an inner lining, and that's your endosteum. And this is an example of spongy bone. There is marrow in there, both red and yellow. The yellow has fat or adipose tissue, and the red has blood. And that's also another function of your bone is hematopoiesis. Hemato means blood, poiesis production of. So if you have bone disease, what else is going to also get affected? Your blood. If you have a blood disease, what else is going to get affected? Bone. Remember, we learn all of these systems separately, but in real life, they're all connected. And you can see here, there's a muscle here, and there's a tendon because it's connecting straight to bone. Okay. Here, you'll also see some cartilage here on the proximal epiphysis. This line here is called the epiphyseal plate. Well, it's called an epiphyseal line when you're growing up when you're a kid. Plate when you're growing up when you're a kid, and it becomes this line. And this is also a way that we can age our patient. If you've ever watched NCIS, when they're like, they look at the bones and they could tell a lot about, the age and sex of the victim. Sorry for the little gruesome example there. Hypercalcemia, right? Emia, blood condition. Hypo, decreased. Hyper, increased. Calc, blood. And remember, too much of a good thing is bad. Too little of a good thing is bad. Everything has to be just right in the human body. And that's called homeostasis. Stasis means to stand. Homeo is same. So your body always likes to stand in the same place. It doesn't like too much and it doesn't like too little. Genesis, formation of bone marrow, osteogenesis. Genesis, if it's the beginning, it's the creation or creation of. So osteogenesis, creation of bone. Pathogenesis, creation of disease. Right? Osteomyelitis, oh, that's not fun, right? You have the bone marrow, it has a pus formation, very painful. But if it goes, but it eats up a nerve, it's not painful. And for diabetics, you don't feel squat. Arthroscopy, I've had this done to me. Scopy, process of viewing arthro, the joint. And also, not only we can do stuff there, they can sew stuff, they can do surgeries here. Your patella, your femur, or your thigh bone. Remember your tib fib here. And then you have a whole bunch of tendons and all this other stuff in your knee. And then think about it. We'll just go back here for a minute. Think about it. What's easier, me cutting all of this open, or just having two or three holes? One for irrigation. They usually fill this up with either air or water, and then you have a viewing scope, and then you have this little grab nabber here that it can trim away things, cut things, and nowadays we can even do via arthroscopy, even suture. Pretty neat stuff. This is hip replacement, you can see here, and you can see it replacing the damaged proximal epiphysis, like a ball and socket. That's a nice skeleton to look at. Different types of fractures, you'll learn that in clinical, don't really need it now. Here is your spine, and you can see this is the normal curvature of spine. Your spine should be curved this way when you're looking at it from the lateral view. And then you can see the smaller bones here are part of your neck or your cervical. The bigger bones, and they have facets here that connect to your ribs, and that's your thoracic. And then you have your lumbar, which are thicker around your loin area. And then you have your sacral here. These are nice. These are good, actually. AP and PA, we already know, anterior, posterior. So if I'm looking at a chest x-ray, an AP view, the beam of the x-ray is going from the front to the back, anterior, posterior. And PA view is posterior, anterior. CT, computerized tomography. Tomo means location, graphy means the process of drawing or recording. Now, DO, doctor of osteopathy, that means they're experts at, well, back in the day, they were experts at disease of bone. But over the last 20 years, their role has been greatly expanded, and they have the same exact responsibilities as MDs. Actually, you probably got seen by a DO, and you probably didn't even notice the different letters at the end of their name because they do the same thing. Now, the way we label bones and the nerves, let's go back to this. The way we uh, vertebrae. So the way we label the different the, different nerves and the different types of vertebrae, like which vertebrae are we talking about? There's a number system. So the cervical spine is C1 through C7. And since there are 12 thoracic, it's T1 through T12. The lumbar, L1 through L5. And the sacrum, it's fused, so you have your coccyx, which is your sacral 2 nerve, and your S1, which is your fused 5 bones of your sacrum. So if they say there's damage in L3, L4, that means what? The third and fourth lumbar vertebrae. If my patient had a C2, C3 fracture, that's what? Cervical 2, cervical 3. And you could see how also in neurology, how there are nerves that come out of here. And if there's damage to the vertebrae, there's also going to be stuff that you're going to see clinically. Right? And that's for another lecture, but you get the point. Okay, and that's where we get these number systems. RA, rheumatoid arthritis, rheumatoid, oid, resembling rheumat or liquid, right? It's the liquid portions that get messed up. Actually, it's a liquid portion of your synovial joint or your synovial fluid. Your body, it's actually kind of classified as an autoimmune disease, auto meaning self. Your body actually will attack itself. I have RA, so it's your immune system thinks that the fluid inside your joints is foreign, so it attacks it, and that's where you get the joint inflammation infection, hence the term rheumatoid arthritis. Muscular dystrophy, abnormal, troph, growth. So abnormal growth of muscles, and that's MD, and it's congenital, so you get that, and it's progressive. You get it when you're a kid, and then it gets worse. Myasthenia gravis, again, another autoimmune. Your body gets confused, so it starts attacking the spaces in between your nerves that send the signal to your muscles. And if it does that, it tells your muscles to progressively shut down. And that's scary because think about it. Your heart's a muscle, and so are the muscles that help you breathe. So it gets a little scary. And sprain and strain, like I talked about earlier. Torticollis. Torti is means like a tortoise, like a turtle. So torticollis, also known as wry neck, it's very common. You get spasmodic contraction of your neck muscles if any of you ever slept the wrong way. Bunion, nice to know. Other these joint disorders, if you want to be a rheumatologist, I guess. And what is that? Okay. Carpal tunnel syndrome. Crepitation or crepitus. Sounds like this. When you crack your knuckles, if you heard that, if the microphone picked that up. But it means rubbing together. And joint disruption. Not a good sound when you're doing CPR. That's for another story. Sarcoma, ganglion cyst. A ganglion is a group of nerves. The cyst, which is like usually a bag of pus, will get. Now gout, I have that too. It's not fun getting older. You get excessive uric acid in the blood and in your joint space, And then again, your body doesn't like it, so it looks at the uric acid in your joints as foreign, and it gets very, very painful, and typically attacks like your big toe and the smaller joints of your foot. Here's a slip disc or a herniated disc, also known as a nucleus pulposus herniation, because this is called your nucleus pulposus, and you can see there's a degradation of your cartilage here, of your intervertebral disc. That's a disc in between your vertebrae, and then it starts leaking out, and then it'll pinch the nerves, and it'll cause one or two things. You'll either have weakness or you'll have pain. RA, we talked about. Yeah, this is my near future. Rotator cuff injury, maybe you've heard of that. When they talk about in sports where the pitcher threw out his arm or threw out his shoulder. Dislocation, partial, is called subluxation. Clubfoot, talipes equinovarus. It means actually equine means horse, like some sort of horse foot, like that. Well, we fix that surgery and braces. Kyphosis, abnormal curvature. Remember, this is normal curvature, but scoliosis, kyphosis, lordosis is called swayback, kyphosis is called humpback, and scoliosis. And that's what they were doing. For those of you who remember that, they asked you to take your shirt off in gym, right? And the nurse would look at your back. They're looking to see if the shoulder blades are even. If the shoulder blades are not, then you have potential scoliosis and you need to go see the doctor. And we fix that with braces and physical therapy. Spondylolisthesis, slipping of the vertebrae where your vertebrae start overlapping. Spinal cord compression. Again, not fun. Arthrocentesis, we can also remove fluid out of the joint space. Arthroplasty, you can surgically repair. NSAIDs, this is a really, really common abbreviation. Non-steroidal anti-inflammatory drug. And stuff like ibuprofen, very common. Alrighty, and I think we should be winding down. A lot of this are wash, rinse, and repeat of the various words. I'm trying to see if there's anything. And last but not least, kindly look at this radiology report, and also try to look at this operative report right here, and that's what you're going to base your 10 items quiz. I suggest 5 on one, 5 on one case, 5 on the other, and that should be your 10. Alrighty, that's about it for this week 7. And again, registration, and I'll see you guys next week. Have a good one.